1 in 10. The U.S. Surgeon General reports that 10% of children and adolescents in the United States suffer from serious emotional and mental disorders that cause significant functional impairment in their day-to-day lives at home, in school, and with peers.
This school year, the Anoka-Hennepin School District is taking an increased role in addressing these issues in their student population.
Most people are familiar with the idea of school counselors, someone who can help guide students in their post-secondary decisions, and someone who they can talk to about the issues in their lives.
Historically, I think schools have taken a role in supporting kids' mental health, so that has already been in place. This is just kind of an extension of those services.
This new extension includes providing mental health therapists in schools throughout the district and making mental health services available to students from elementary through high school. Dr. Kumar came to Anoka-Hennepin with experience as a school-based mental health therapist and experience working with health insurance plans. And once in the district, she initiated school surveys about student struggles.
I did a principal questionnaire for each of the sites that were going to get a mental health provider and asked principals to just kind of summarize some of the mental health issues that they're seeing. So some of the issues that have been identified pretty consistently were related to depression and anxiety. So those seem to be the two biggest issues that some of our students are struggling with.
Now, teachers and staff have been tasked with spotting children who may benefit from their new service.
Part of my recommendations that I've made to the school district is related to early identification of mental health issues. So teachers, staff, district administrators, everybody will receive some early warning signs that they can be on the lookout for, just kind of some red flags.
Students are not forced into therapy, but the student and their parents are given the option. Once a student starts seeing a therapist, what their time looks like is completely based on the student's needs.
It's very individualized. It's really based on what the student needs are, how intense, how critical, how much it's impacting various areas in their life. So it's impacting home, school, medical, just a whole range of things. And they may meet more frequently. They may be in treatment for a longer period of time.
In the past, the district has given referrals to mental health agencies that could help. But a referral only goes so far for a family who doesn't have a flexible work schedule or who may be dealing with transportation issues.
Some barriers in the past would have been parents having to take time off work to transport their child to a provider. Just transportation, sometimes in general, was an issue. Being uninsured had been a problem in the past, and then being underinsured where they had insurance coverage but maybe didn't have a mental health or substance abuse benefit in their health plan.
With this new plan, the school district bills students' health insurance companies directly and then pays the cost of anything not covered by insurance. The district has applied for a state grant that funds school-linked mental health programs and hopes to be able to expand their program in the future and add up to 11 more full-time therapists in schools. Therapist positions that schools are already asking for.
I'm hearing a lot from people in buildings that don't have a mental health professional asking for support and services, and I'm also hearing from a lot of parents who are asking for services. So clearly there's a need, and people have been pretty receptive.
Overall, Dr. Kumar says that addressing mental health issues as early as possible helps the student, the school, and the community.
So I think it benefits kids in their education, improving their kind of social, emotional outcomes, better grades, better attendance, and less issues with behavior or conduct things going on. So how it benefits the community in general, I think, is being able to see those same types of benefits out in the community. You're likely going to see less criminal activity, kids who are more supervised, or when they're in an unsupervised or unstructured setting, behaving in a manner that's more safe and acceptable.
For North Metro TV News, Danica Peterson reporting.
This program will also have some availability during the summer months, and there's the potential for therapists to conduct sessions at families' homes. The district will find out if they have received a portion of the $43 million state grant before the end of the year.